Yeah, as a dachshund owner, when I saw this article, I knew this was something I wanted to take a look at. And I think as a general practitioner, this is something a lot of us unfortunately see pretty commonly in practice, and that is acute disc extrusion. And so this study looks at the idea of conservative management and what the outcomes are. I know in the clinic, a lot of times that's a question that we get from our pet owners. And the question we ask ourselves too is this patient a surgical candidate, or is it someone that may be successful with medical management? I know early in my career, a lot of times I was quick to recommend surgery. I kind of thought of that as the gold standard for some of those more severely affected patients. But I think as we learn more and more, it is helpful to look at data like this to make the best decision for our patients and our pet owners.
I agree. I really appreciated the 12-week window that was mentioned several times in this study, because I think when these patients come in and with their owners, the owners are seeing a dog that has significant lameness at this point, and they are overwhelmed by that, and then they can't always take in the information that we're giving them. But having that concrete number to let them know that recovery can take up to 12 weeks, and that you shouldn't lose hope in the first 2-3 weeks, really sets them up for the journey, so that they're not getting 2-3-4 weeks down the road and maybe only seeing 25 to 50% improvement and thinking this is it, this is all it's going to be for my dog. We can really set those expectations earlier, so that they are a little more prepared for the length of time that this can take in some patients.
Yeah, I think that's a good point, Peggy, because I know a lot of times, even as the doctor in the situation, I start to second guess things too. If they don't recover quickly and if the pet owners keep calling, really worried about the patients, I think, like you said, setting those expectations is one of the most important aspects of case management here.